Hello again, this is Mrs. Dragoo. I'm bringing you voice lesson today. It's taking a little step further from my previous lesson. This lesson is on voice production and articulation, specifically talking about the care and feeding of your voice. Okay, so let's take a few minutes to focus on our lesson, get comfortable, put away things that might be distracting you. Make sure that you are all stretched out. Maybe move your neck around a little bit. And let's take 3 deep breaths in through our nose and exhaling through our mouth. Ready? Inhale. And exhale through your mouth. As you inhale, make sure you're making your diaphragm get bigger. Inhale. And exhale. One more breath will help us get ready for this lesson, putting away everything else that's gone on today. Inhale and exhale. The reason I do that is because we all have so much going on in our lives that when it's really time to focus on something that's important for us as performers, we really need to take the time to make sure we're focusing on learning something that is going to benefit us. The objective today is that you will understand how your voice works and apply some health and wellness concepts related to music practice and speaking, such as your body mechanics, your vocal health, hydration, and the appropriate hygienic practices. Okay? Why is this important? Well, by understanding how your body works with your vocal cords to create sound, will help musical theater students and actors develop a stronger singing and speaking voice. As you practice health and wellness related to music and vocal technique and body mechanics and hydration and using good hygiene, you'll understand how health, wellness will affect your vocal resonance. So, what are the vocal requirements for theater arts, whether it be musical theater or speaking theater? I want you to think about this. You have to use your voice to be loud so that you can be heard, flexible enough to add subtle layers of character, emotional texture, and meaning to your lines, and your voice has to be strong enough to withstand long rehearsals and intense performances. So actors should never stop working on improving their voices. Even if you're a professional performer like my daughter, you still take voice lessons. You still use all the things that you can to improve your instrument, which is your voice. A lot of people have asked, how is our voice created? So I'm going to play this little video for you right now. I'm going to take a few minutes to look at it.
The human voice system is like a musical instrument. At its center is a vibrating element that produces sound with varying tone and loudness. The vibrating element in the human voice is the vocal cords. When air is exhaled from the lungs and through the larynx, it causes the vocal cords to vibrate. During normal breathing, the vocal cords are held apart and no sound is produced. But when the moving cartilages are drawn together by muscles, a vibrating gap is formed that generates sound. The cartilages tilt to control vocal cord tension, and like the strings of a musical instrument, the greater the tension, the higher the pitch. The lower the tension, the lower the pitch. Loudness depends on how fast the air moves past the cords. When we yell, we have to push the air rapidly through our vocal cords. Speech is formed by a combination of tongue, mouth, and lips all working together to control the flow of air and sound from the vocal cords.
Okay, so that gives you, it's an old video. It reminds me of something we used to watch in science when we had to watch the old films. But this is a good example of how the voice is or how sounds are created with your voice. What I'd like to do now is to show you how your voice is like a car. So let's take a few minutes to watch this video.
You know, Tony, too many people take their voices for granted. It's a shame.
The voice is one of the marvels of creation. You know how it works?
Of course I know how the voice works. Everybody knows how the voice works. How does the voice work?
Works like a car.
Like a car.
Like a car.
A voice is like a car because they both make noise. My colleague Brad Story actually worked for a company and designed mufflers, and I credit him with his analogy, actually, of the voice in the car. Both machines, the human and the car, convert energy from one type to another, from chemical to mechanical first, and then finally to acoustic energy. In the case of the car, of course, the source of energy is chemical energy from the gasoline. In the human, it's basically the energy from the muscles that drive the lungs and push air. In a car, the valves open and close, and we get big bursts of sound coming out from the engine. In the case of the human voice, the muscles around the lungs produce a force against the lungs, and then the air gets expelled, and the vocal folds begin to vibrate. The vocal folds are two small pieces of flesh that are in our larynx, in our voice box, and they have to vibrate in order to make sound. Not only do they have to vibrate there, but they have to collide in the process. Just like in a hand clap, I can go back and forth and you hear nothing. But the minute I contact the two together, then you start hearing sound. It's that sudden interruption of the air by making complete closure that gives us the many frequencies that we need in the sound.
We take in air through negative pressure developed by expansion of the chest, and as that air releases passively and we fix our vocal folds in a particular position, the vocal folds vibrate. Now, the pitch of that sound is determined by the speed with which the air flows through, and a couple of other factors, but probably most importantly is the tension on the vocal folds or the position of the vocal folds.
The mass and the tension and the elasticity of the vocal cords may cause different vibrations, and as such, the acoustic signal may vary. Sometimes people have simulated or attempted to measure this sound that's generated here, and what they hear is almost a buzzing sound. Not a nice sounding voice as we hear out here, but a buzzing sound begins here. And that sound then is shaped by the vocal tract, and resonant properties are imposed on that sound to generate a voice that sounds as a human voice does.
If you were to hear the sound of our larynx without the rest of the vocal tract, it would sound kind of not like what we're used to hearing.
Where shall I go? What shall I do?
Some of the sound that is initiated right here at the vocal folds should get out to the listener, but we want to condition it. We want to take some of its frequencies and downplay them or dampen them, and then we want to enhance some other frequencies. And so there's another piece in this whole similarity between the car and the human. What does the muffler do? The muffler is designed to condition the sound, if you will, like an air conditioner conditions the air. The muffler is made of a series of sections of pipe, and they expand and contract. This repeated expansion and contraction filters this sound and takes out the frequencies that we don't want. That does the same thing in the voice. The sound we produce is fairly dull by itself, but when you filter it with a vocal tract, some of the frequencies are reflected in and out, and they don't come out very well, and others penetrate right through. And that selectiveness of the frequencies then helps us decide whether it's an oo or an ah or an e that's being said, or even whether it's one kind of a voice quality or another.
That's a really interesting concept. If you think about your voice like a car, you have mechanisms that are working here in your vocal tract that help the sound to be created. This is a diagram that I created that kind of helps you understand the parts of your vocal tract. So if you look at the cross section of someone's head, you have everything from a nasal cavity, a palate, oral cavity, tongue, lips, jaw, larynx, pharynx, epiglottis, larynx opening into the pharynx, and your esophagus. All of those things make up what's called the vocal tract. This, as an actor, is your instrument. The vocal tract has two parts. It has resonators and articulators, okay? So you're thinking about the parts of your instrument. If I play the saxophone, which I do, I have the neck of the saxophone and the reed, and then I have the body of the horn. So in your vocal tract, you have two parts. The resonators, which are made up of the nasal cavity, the palate. Up here I have the red little mark that you can see, your nasal cavity, your palate, and your oral cavity. These are used to produce voice quality sounds like M and N. Those are the sounds like M, N, V. The sounds that come through your nasal cavity, your palate. Articulators are the teeth, the lips, and the tip of the tongue. They help you create hard sounds like B, T, and P. So voice production then, just to kind of repeat what that both of those videos said, speech sounds are made by air forced through your lungs by your diaphragm. The exhaled air vibrates the vocal cord and the larynx. The sound produced is modified by the resonators, the throat, nose, mouth, and sinuses. And the sound is then formed into vowels and consonant by the articulators, the tongue, jaw, teeth, cheeks, lips, hard and soft palates. This is a song that I would like for you to learn. It's silly, but it will help you remember how the voice is created. Okay, I'm going to try and sing it to you, but don't laugh at me because it's silly, okay? The air begins in the diaphragm, then works its way to the larynx. The vocal cords vibrate, creating the sound. Pushing it up through the pharynx. Soft palate, hard palate, tight. Let me start over. Soft palate, hard palate, tongue, teeth, and lips help to shape the sound. Open it up and let it out. La, the music is found. It's a silly way for you to remember how the words are created from the sounds. Voice production then. When exercising your voice, you have to work to achieve controlled breathing, resonance, which is a warm, rich quality of sound, and variety in your pitch, volume, inflection, and rate. When breathing in, you want to breathe from your diaphragm. I said this in another lesson that you have to think of your diaphragm, which, as you can see on the diagram, the diaphragm is the muscle right underneath your lungs, inside your rib cage. Think of it as a balloon. As you blow air into the balloon expands, gets bigger. And when the air comes out, it decreases and empties. So your diaphragm has to be thought of as a balloon. When you inhale with your diaphragm, your chest cavity stays still while your waist and the diaphragm expands. Breathing from your diaphragm requires less effort than chest breathing. So if you'll sit up really tall, put your hands here, one below your chest, one above your belly button. You have your hands like this. When you inhale, your hands should expand that diaphragm, come out, and then they should go in when you exhale, just like in the picture. So take a deep breath and exhale. It's opposite of what we do in normal day breathing because we normally get lazy as we get older, and we don't want to breathe like this because then our air is trapped. We don't want to use our whole chest cavity. We only want to use the diaphragm. So how do you know when your voice is healthy? So look at these questions, and as I ask them, if you answer yes to any of the following questions, you may have a voice problem. Has your voice become hoarse or raspy? Have you lost the ability to hit some high notes when you're singing? Does your voice suddenly sound deeper? Does your throat often feel raw, achy, or strained? Has it become an effort for you to talk? Do you find yourself repeatedly clearing your throat? If you answered yes, first of all, you might have a problem. And if you think you have a voice problem, you have to consult a doctor to determine the underlying cause. Okay? The doctor who specializes in disease or disorders of the ear, nose, and throat, an ENT, is the one that can best diagnose your voice disorder. They are also called an otolaryngologist. Sometimes we call them ENT, but your ENT can refer you to a special language pathologist. Speech pathologist can help you improve ways to use your voice. So I'm going to give you an example of that. I had thyroid cancer and the doctor removed my thyroid. When he did, he nicked my left vocal cord, causing my left vocal cord to be paralyzed. And I can no longer hit the high notes that I used to sing in the upper voice, in my head voice. So I have had to go to a voice therapy to learn to sing and to help my left vocal cord remember what it's supposed to do. And so now, as I'm learning to sing more, and I'm singing more, and I'm exercising the muscle, then my left vocal cord is remembering what to do. If you have a yes to one of those questions, then you need to consider seeing an ENT, because your throat is the cavity which holds your most important asset as a performer, and that's your voice. Well, what causes voice problems? There's a lot of different things, sometimes upper respiratory infections, inflammation caused by gastroesophageal reflux or what's called GERD, sometimes heartburn, misuse or overuse of your vocal cords, like going to a concert and shouting and singing at the top of your lungs, or at a football game screaming and yelling for your team. Sometimes we develop growths on our vocal cords, such as nodules. And sometimes you can have cancer of the larynx or around your larynx, and the cancer around that can cause problems. Sometimes there are neurological diseases like spasmodic dysphonia or vocal cord paralysis, which is what I have, and sometimes psychological trauma. Most voice problems, though, can be reversed by treating the underlying cause or through a range of behavioral treatments, which is what I did. So they're not hard to fix, but it's a matter of taking care of your voice and figuring out what you need to do to make your voice be better and be repaired. So here's some tips to prevent voice problems. First of all, stay hydrated. Drink plenty of water. 6 to 8 glasses a day is what's recommended. And I'm not saying any liquid, I'm saying water, okay? Limit your intake of drinks that contain caffeine and alcohol, which can cause your body to lose water, and it can make your vocal cords and your larynx dry. Alcohol irritates the mucous membranes that line your throat, and caffeine dries out your vocal cords. If you're in the middle of a production, I highly recommend you quit drinking caffeine for the duration of your show. Use a humidifier in your home. This is especially important in the winter or dry climates, because a 30% humidity is what's recommended to keep your vocal cords nice and lubricated. Avoid and limit your use of medications that draw out your vocal cords. A lot of them are things you take for cold and allergy seasons. If you have voice problems, ask your doctor which medications could be the safest for you to use. So let's go through some things that will help you use your voice wisely. Try not to overuse your voice. Avoid speaking or singing when your voice is hoarse or tired. Give that instrument some rest, okay? Rest your voice when you're sick. Put it on what we call vocal rest, because illness puts extra stress on your voice. Coughing and whispering are terrible for your vocal mechanism. Avoid using extremes of your vocal range, such as screaming or whispering. Talking too loudly and too softly, it puts stress on those vocal cords. Practice good breathing techniques when singing or talking. Support your voice with deep breaths from your chest, and don't rely on your throat. Many singers and speakers strain like this, and you don't want to do it. You want to speak from your diaphragm and learn to take that breath control. Talking from the throat without supporting your breath puts a big strain on your vocal cords. If you can feel the speaking and singing from your neck, you're doing it incorrectly. Avoid cradling your phone when you're talking. A lot of people put their phone here and hold it with their shoulder. But doing this for an extended period of time causes much muscle tension in your neck. And then the muscle tension in your neck causes the muscles in your vocal mechanism to be strained. Consider using a microphone when it's appropriate. In a relatively static environment, such as exhibit areas or classrooms or exercise rooms, a lightweight microphone and an amplifier speaker system can be of great help. Avoid talking in noisy places. When you go out to a restaurant and it's a really loud place with lots of noise, avoid trying to talk over that noise. Trying to talk above that noise is going to cause a strain on your vocal cords. Most importantly, you need to maintain a healthy lifestyle and a healthy diet. Don't smoke and avoid secondhand smoke because smoke irritates your vocal folds. Also, cancer of the that's hard to say. Cancer of the vocal folds is seen most often in individuals who smoke. So we lose a lot of our wonderful performers who are out there smoking because they think it'll help them lose weight, but really what it does is it is a cause of cancer and dries out your vocal folds. Avoid eating spicy foods. Spicy foods can cause your stomach acid to move into your throat or your esophagus, causing heartburn. This is also called GERD. You don't want that. So don't eat that, especially when it's close to bedtime. Avoid spicy foods when you can. Include plenty of whole grains, fruits, and vegetables in your diet because those include vitamins A, E, and C, and they help keep your mucous membranes that line your throat healthy. If you have persistent heartburn, you need to talk to your doctor about diet changes and medications because that will help you reduce some of the flare-ups. Wash your hands often to prevent getting the cold or the flu. That's something we're all doing right now, making sure our hands are clean and using hand sanitizer. Getting enough rest is important for your voice because physical fatigue has a negative effect on your vocal cords. Exercise regularly. Exercise increases stamina and muscle tone, and your vocal cords are muscles. So this helps provide good posture and breathing that are necessary for proper speaking. Avoid using mouthwash or gargles that contain alcohol or irritating chemicals. If you still need to use a mouthwash that contains alcohol, limit it to oral rinsing. If gargling is necessary, use salt water, but only rinse using a mouthwash and then spit it out. Avoid using mouthwash to treat persistent bad breath. Halitosis, or what we call bad breath, could be a problem that the mouthwash can't cure, such as a low-grade infection in the nose, sinus, tonsils, gums, or lungs, as well as it could be from gastric reflux of your stomach. Mouthwash is not going to help that. Thank you for joining me today in this lesson on caring and feeding of your voice and your vocal cords. I hope that you've learned something. What I'd like for you to do is to practice all of the great breathing techniques and the healthy lifestyles that can help you improve your voice. I hope that you've learned something today, and I'll see you next time.